Thank you for listening to Depictions Media Radio. And welcome back, everyone. So, next up is a virtual meeting with Dr. Theresa Tam, Dr. Njoo, and Patty Hajdu, Anita Anand, and Dominic LeBlanc as federal ministers and public health officers to provide an update on the ongoing information with COVID-19 for Canada. And they are also trying to outline guidelines for progressive reopening as vaccinations ramp up during the summer, which will allow people to attend small outdoor gatherings. As people receive their second doses ahead of fall, indoor gatherings will then be allowed. Minister Anand also announces that Canada will receive a total of 4 million doses of Pfizer and Moderna vaccines on the week of May 17th, as Pfizer has agreed to move up delivery schedules for the week of May 24th due to the upcoming Victoria Day holiday. So let's listen to what they actually have to say in this next segment, and hopefully there may be an end to lockdowns in other pandemic procedures and restrictions by the fall, if everything they say goes as planned. So let's listen to what the plan sounds like.
So, good afternoon, everyone. Bonjour tout le monde. Merci d'être avec nous aujourd'hui. Aujourd'hui, je suis accompagné par la Dr. Tam et le Dr. Njoo et mes collègues, la ministre Hajdu et la ministre Anand. Depuis cette semaine, plus de 50% des Canadiens admissibles ont reçu leur première dose de vaccin et beaucoup d'autres recevront leur vaccin dans les semaines à venir. As of this week, more than 50% of eligible Canadians have received their first dose of vaccine, and many more will be getting their vaccine in the coming weeks. This is good news, and when it's your turn to get vaccinated, please do so. I would now like to turn to my colleague, the Health Minister, Patty Hajdu. Patty?
Merci, Dominic, and good afternoon, everybody. As we end a week of appreciation for nurses, I first want to start by saying a profound thank you to everyone nursing across the country. I've had amazing conversations all week with nurses that are nursing in public health and primary care, doing research, supporting people all across this country. And I want to thank every single nurse for caring for our close ones and for the sacrifices that you're making every day, especially during this time of this extraordinary public health challenge. Like all Canadians, I look forward to the day where in my community of Thunder Bay, Ontario, we do get back to a normal life. But we all know we still have work to do to get there. So today, I'll share with Canadians that we have published a roadmap discussed with all the provinces and territories that will guide us as we ease our restrictions. Dr. Tam et Dr. Njoo pourront en parler plus en détail dans quelques instants. Mais voici un aperçu des indicateurs à suivre avant de réduire les mesures de santé publique. La transmission de la COVID-19 est contrôlée à un niveau gérable. La capacité du système de santé publique est suffisante pour tester, retracer, isoler et mettre en quarantaine une forte proportion de cas et des personnes qui ont été en contact avec des personnes infectées. il existe une capacité suffisante en matière de soins de santé pour réagir aux flambées. Et des mesures de réduction de risques sont en place pour la population vulnérable et dans le milieu à risque élevé. As more and more Canadians are getting vaccinated, provinces and territories can use these guidelines to inform how and when specific measures should be eased. And here's what that means for you. For now, you need to keep following public health advice, whether or not you've been vaccinated, to keep yourself, your family, and your community safe. More people need to be vaccinated before we can ease restrictions. And that's why I encourage you to reach out to help friends, family, neighbors, colleagues who might need help booking or getting to a vaccination appointment. For the summer, as Dr. Tam shared with Canadians, if 75% of us that are eligible for vaccines have one dose and 20% have had a second dose, we can start to see these restrictions be lifted based on public health situations in your area. You'll need to continue to follow the local public health advice and keep up with individual measures like physical distancing and wearing a mask indoors. But you can look forward to small outdoor gatherings with family and friends. And in the fall, if 75% of those eligible for vaccines have received a full COVID-19 vaccination series, then local public health could be able to lift even more measures. And we should be able to do more activities indoors with people outside of our household. We all have it in our power to increase our chances of having a safe summer, a better summer for everyone. So please continue to choose activities that present lower risks to you and to your family, and keep following public health advice to help your local public health unit get to a place where restrictions can be eased in your community. I want to thank every single Canadian who stepped up to get vaccinated when it's their turn. I too have joined you, and I am so proud of all of you who are taking that important step to save lives and stop the spread. Thank you. Merci.
Merci beaucoup, Patty. Alors, on va se tourner maintenant vers notre collègue, la ministre Anand. So, Anita, over to you.
Thank you so much, Dom, and good afternoon, everyone. Today, I will provide an update on vaccine deliveries into Canada and milestones that we have reached. As of yesterday, more than 20 million doses of COVID-19 vaccines have arrived into this country. Canada is currently in the top G20 countries across a number of metrics, including total doses administered per capita, percentage of population that has received at least one dose, and average daily vaccination rates. In particular, 42% of all Canadians have had at least one dose of vaccine, and more than half of all Canadians who are adults have received at least one dose. In terms of individual suppliers, Pfizer is delivering 2 million doses per week this month and will deliver 2.4 million doses each week in June, constituting 5 deliveries in June alone. 42% de tous les Canadiens ont reçu au moins une dose et plus de la moitié des adultes canadiens ont reçu au moins une dose. Pfizer livre 2 millions de doses par semaine ce mois-ci et livrera 2,4 millions de doses supplémentaires par semaine en juin. In fact, due to the upcoming Victoria Day holiday, Pfizer has agreed to deliver doses earlier by moving up a significant portion of the deliveries scheduled for the week of May 24th. So, next week, Canada will receive a total of 3.4 million Pfizer doses, 2 million arriving as scheduled early in the week, and 1.4 million doses arriving on Thursday and Friday ahead of the holiday weekend. The balance of the scheduled doses for the week of May 24th, approximately 600,000, will arrive shortly after the holiday Monday. Combined with the upcoming delivery of 1.1 million Moderna doses next week. Canada will be receiving 4.5 million doses in total next week. To repeat, 4.5 million doses of Pfizer and Moderna are arriving to Canada next week. We are continuing negotiations with our suppliers to accelerate deliveries so that the provinces and territories can get vaccines into the arms of Canadians as rapidly as possible. Across the country, we are seeing provinces and territories expanding the groups eligible to book a vaccine. Le gouvernement continuera de travailler sans relâche jusqu'à ce que tous les Canadiens qui souhaitent être vaccinés le soient. The government will continue to work to bring millions of vaccines to this country for all Canadians. This is my goal and sole focus, and I will not relent, as we all recognize the importance of having enough vaccines for all Canadians. Thank you. Merci. Miigwech.
Thanks very much, Anita. We're now going to turn to Dr. Tam and then to Dr. Njoo. Theresa.
Bonjour à toutes et à tous. On a national level, we're seeing hopeful signs that we've passed the peak of the third wave. The latest 7-day moving average of daily case counts is more than 20% lower than the peak in April, dropping to less than 7,000 cases daily for the first time since early April. We're also beginning to see reductions in the number of people experiencing severe and critical illness, with less than 4,000 people with COVID-19 being treated in our hospitals each day, including less than 1,400 in intensive care, and an average of 48 deaths being reported daily. This is important progress, but the numbers are still too high. We must drive infection rates down much lower while getting our vaccine rates as high as possible. To date, over 17 million COVID-19 vaccine doses have been administered across Canada. This is great news and improving every day. But we can't let go of the public health measures and individual precautions that are our essential safety ropes to prevent another resurgence on this tricky path. As our modeling shows, by maintaining control measures until at least 75% of eligible adults have received a first dose of a COVID-19 vaccine and at least 20% of them have had their second dose, we would drive infection rates low enough and raise vaccine protection high enough to allow for lifting of restrictions without overwhelming health systems. But one dose of a 2-dose vaccine series is not enough to maximize protection. We need to aim for at least 75% of everyone who is eligible for vaccination getting fully vaccinated. And we can't go halfway. So it is very important to get that second dose. The good news is that our first target is within sight. 4 weeks ago, less than 25% of adults had received at least one dose of COVID-19 vaccine, and now we're at just over 50%. This month, with significant increases in vaccine supply, ramping up of vaccination programs, and Canadians coming forward as well as encouraging others, we're making great strides and can look forward to enjoying an outdoor summer that gets us back into many of the activities we've been missing. In very general terms, this means we'll be able to get back to small outdoor gatherings with family and friends, camping, outdoor sports, small reunions at picnics, parks, and patios will begin to bring us together in person again. We will still have to follow local public health advice and keep up with individual measures, like physical distancing and wearing a mask as recommended. Heading into the fall, as more and more Canadians get fully vaccinated, giving us broader protection across our communities, we'll be able to look forward to moving indoors together. This would mean getting back to indoor work, in-person learning at colleges and universities, and recreational activities, as well as finally being able to get back to the in-person multi-household celebrations and holidays we've been longing for. To get to this better summer and fall, we need to keep doing everything we can to protect ourselves and our communities, ease the pressure on the health system, and help bring an end to this pandemic. This includes rolling up your sleeves to get vaccinated as soon as you are able. Thank you.
Bonjour à toutes et à tous. À l'échelle nationale, nous décelons des signes encourageants que nous avons franchi le pic de la troisième vague. La dernière moyenne mobile sur 7 jours de nombre de cas quotidiens est plus de 20% inférieure au pic d'avril et s'établit à moins de 7 000 cas quotidiens pour la première fois depuis le début d'avril. Nous commençons aussi à enregistrer une réduction du nombre de personnes qui tombent gravement malades ou se retrouvent dans un état critique, car moins de 4 000 personnes atteintes de la COVID-19 ont été traitées dans nos hôpitaux chaque jour, y compris moins de 1 400 qui ont été traités aux soins intensifs, et 48 décès étaient signalés en moyenne chaque jour. C'est une amélioration marquée, mais le nombre de cas est toujours trop élevé. Nous devons réduire bien plus les taux d'infection tout en faisant grimper les taux de vaccination le plus haut possible. À ce jour, plus de 17 millions de doses de vaccins contre la COVID-19 ont été administrées dans tout le pays. C'est une excellente nouvelle et la situation s'améliore de jour en jour, mais nous ne pouvons pas nous passer des mesures de santé publique et délaisser les mesures de prévention individuelles qui sont les balises à respecter pour éviter une autre recrudescence de cette crise. Comme le montrent nos travaux de modélisation, c'est en maintenant les mesures de contrôle jusqu'à ce qu'au moins 75 des adultes admissibles aient reçu une première dose de vaccin contre la COVID-19 et qu'au moins 20% d'entre eux aient reçu une seconde, que nous pourrons abaisser suffisamment des taux d'infection et augmenter suffisamment la couverture vaccinale pour pouvoir lever les restrictions sans surcharger la capacité de notre système de santé. Or, une dose de vaccin sur une série de 2 ne suffit pas à maximiser la protection. Nous devons avoir comme objectif qu'au moins 75 de toutes les personnes admissibles à la vaccination soient entièrement vaccinées. Nous ne pouvons faire les choses à moitié, donc il est très important de recevoir la seconde dose. La bonne nouvelle, c'est que notre premier objectif est en vue. Il y a 4 semaines, moins de 25% des adultes avaient reçu au moins une dose d'un vaccin contre la COVID-19 et nous atteignons maintenant presque les 50%. Ce mois-ci, grâce à l'augmentation importante de l'approvisionnement en vaccins, de l'intensification de la campagne de vaccination et des Canadiens qui ont répondu à l'appel et ont encouragé les autres, nous faisons énormément de progrès et nous pouvons envisager un été à l'extérieur où nous exerçons de nouveau un bon nombre des activités que nous avons manquées. De façon très générale, cela signifie que nous pourrons organiser de petits rassemblements à l'extérieur avec nos proches et nos amis. Grâce au camping, au sport d'extérieur et à des petits rassemblements lors d'un pique-nique dans les parcs ou sur les terrasses, nous pourrons être ensemble à nouveau en personne. Il nous faudra encore suivre les conseils de santé publique et continuer à prendre des précautions individuelles comme la distanciation physique et le port de masque au besoin. À l'approche de l'automne, au moment où de plus en plus de Canadiens seront entièrement vaccinés, ce qui nous offrira une meilleure protection dans l'ensemble de nos communautés, nous pourrons songer à nous retrouver à l'intérieur. Cela signifie la reprise du travail et des activités récréatives à l'intérieur, le retour à l'apprentissage en personne dans les collèges et les universités, ainsi que les célébrations et les fêtes en personne avec plusieurs familles que nous attendons depuis longtemps. Pour que cet été, cet automne espéré se concrétise, nous devrons continuer à faire tout en notre pouvoir pour nous protéger et protéger notre communauté.
It looks like Dr. Njoo has gone off the...
Alors, peut-être on va commencer avec les questions maintenant. Nous allons maintenant prendre des questions. On a environ 30 minutes. We'll now take questions, and we have about 30 minutes. Do one question, one follow-up. I'll pass it over to the operator to take the first question. Je vais maintenant passer la parole à l'opérateur pour la première question.
Thank you. Merci. Please press star 1 at this time if you have a question. S'il vous plaît, appuyez sur étoile 1 maintenant pour poser une question. Our first question, la première question. Marie Vastel, Le Devoir. Your line is open. À vous la parole.
Oui, bonjour. En fait, ma question est pour vous, Monsieur Leblanc. C'est sur un autre sujet, si vous permettez. Hier, le gouvernement du Québec a déposé sa réforme de la loi 101, comme vous le savez certainement. Le gouvernement a annoncé qu'ils vont notamment modifier la Constitution pour inscrire que le Québec est une nation et que le français est la seule langue officielle. Je voulais savoir, est-ce que le gouvernement fédéral est aussi d'avis qu'une province peut modifier cette section provinciale de la Constitution de façon unilatérale? Quelle interprétation est-ce qu'Ottawa a des amendements possibles à faire?
Ben, Marie, merci pour la question. J'ai, comme tout le monde, pris connaissance de ces propositions seulement hier. J'ai l'intention, j'espère en fin de semaine, de parler à ma collègue, la ministre Lebel, Sonia Lebel du Québec. J'ai pas encore eu cette chance-là. Et moi, j'ai pas eu, et le gouvernement a pas eu à date, par exemple, les avis de M. Lametti, le ministre de la Justice, ou évidemment notre collègue Mme Joly, ministre responsable pour les langues officielles. Alors, moi, j'ai pas de commentaires à faire à ce sujet aujourd'hui. On aura dans les jours à venir, évidemment, quelque chose de plus substantiel à dire.
Est-ce que vous avez commandé des avis légaux au ministère de la Justice ou autre? Et est-ce que vous craignez, sans vous prononcer sur la constitutionnalité d'un amendement constitutionnel, mais est-ce que vous craignez que ça puisse ouvrir une boîte de Pandore et mener d'autres provinces ou des groupes autochtones à vouloir emboîter le pas à Québec et faire leur propre demande constitutionnelle?
Comme vous savez, notre gouvernement, la ministre responsable, Mme Joly, mais le gouvernement a publié un livre blanc, un document qui détaille, je pense, des améliorations, des modernisations de la loi fédérale sur les langues officielles. C'est un document que moi j'ai trouvé parfaitement approprié, qui a eu, au moins en Acadie, mais dans d'autres régions du pays, une réception assez positive. Et ça demeure le focus pour notre gouvernement. On est en train de regarder les questions en termes de projets de loi qui vont faire suite, évidemment, au document que Mme Joly a rendu public il y a déjà un couple de mois. Alors, ça demeure le focus pour notre gouvernement. Et dans les prochains jours ou les prochaines semaines, mes collègues auront peut-être quelque chose à dire quant aux propositions du gouvernement du Québec. Mais pour le moment, moi, personnellement, j'ai pas eu la chance d'être vraiment briefé sur ces questions-là et j'aventurerai pas sur des commentaires précis, ayant pas eu la chance d'avoir ces discussions-là avec mes collègues.
Prochaine question.
Thank you. Merci. La prochaine question. Mia Rabson, the Canadian Press. Votre ligne est ouverte. Please go ahead.
Yeah, hi. My first question is for Dr. Tam. I'm wondering if you could talk a little bit about this return to more normal life and these markers, 75% and 25%. What happens if we don't meet them, and why are they so much higher than what we've seen in other countries? The UK, for example, about half have one dose and about a quarter have both doses. And next week, they're widely opening up much more than you suggest we will be, even at 75 and 25. So I'm just wondering why we're setting the bar so high and what happens if we don't meet those bars.
Yeah, so these are modeling projections about what could happen and with lots of different parameters, assumptions to fill in. But I think having an aspirational target is really a good thing for everyone to aim for. En route to that target, provinces and territories will have to take into account their epidemiologic picture primarily. The UK, if you sort of look back at their epidemic trajectory, they crashed that curve, that very massive third wave to very low levels by the time they got to that kind of vaccine coverage. You need to look at both of those parameters. At this point in time, provinces might be reaching some of these vaccine coverage levels that the UK was seeing when they were lifting, but the epidemiologic picture is completely different. We're still just beginning to peak on this third wave in many different provinces and territories. So what we've done is we've also published some indicators on top of those vaccine targets, because you have to actually let the epidemiology and the data drive the slow reopening measures at the local level. So some of these indicators on top of these targets of vaccine coverage includes looking at your transmission indicators. So if your transmission is controlled in terms of COVID-19, that includes forecasts and reproduction numbers. That includes sufficient testing, tracing, isolation capacity so that you can detect resurgences and do something about them. It includes looking at hospital and other health care capacities before you can safely reopen slowly, staged, and in a sort of thoughtful manner. And so your vaccines will help, will be a major help in helping keep your rates low and point towards a future that includes some of these activities that we've longed for without resurgences happening. And by the way, there's the estimates that we provided, like 75% first dose, 20% second dose, is modeled upon the kind of rates you should aim for if you don't want your resurgences to overwhelm your hospital systems again. That's what that number is for. And so I don't know if that answers your question, but it really is a combination of indicators that people should be looking at, but really important for Canadians to have something to look forward to, and these are aspirational targets.
Mia, follow-up?
Yeah, thank you. My next question, I'm not sure who wants to answer this one, but we received 655,000 doses of AstraZeneca from COVAX yesterday. For now, they're sitting in freezers. There are countries all over the world who would maybe desperately want these vaccines and would use them today. Why did we accept these doses if we're not going to make sure that they're going to get into arms and not sit in freezers?
Maybe I can start. It's Patty Hajdu. Well, I think the premise of the question is a little bit askew because, in fact, there's no indication yet that provinces won't be using AstraZeneca for second doses. And so we're working with them right now to determine their allocations and what provinces and territories will need to complete vaccinations for those people that have had the first dose of AstraZeneca. Obviously, we're monitoring this very closely, and my expectation is that doses of vaccine, regardless of the variety and type, don't go to waste. Perhaps, Dr. Tam, you want to add a little bit more about that?
Yes, so at the moment, in discussion with Chief Medical Officers of Health, broadly all across the country, they've halted any further administration of that first dose, and that any existing supply will go towards provision of the second dose for those who've had one dose already. Based on what I know is just over 2 million doses have been provided as the first dose. So I think this 655,000 would potentially go towards individuals who wish to have the AstraZeneca vaccine as a second dose. But you have a very good point, and I think we are waiting for the studies, including one certainly from the United Kingdom, to determine whether we can provide an mRNA vaccine as that second dose. And I think early indicators show that is a good option but we're waiting for that data and for NACI to provide that recommendation. At that point in time, I think obviously there may be less people who would take up the AstraZeneca vaccine as a second dose, but is it important to still have that option right now? And of course, we need to evaluate the use, thoughtful and ethical use of the vaccines that we have in our country, and we shouldn't take any further doses that we can't use.
Okay, we'll take the next question, please.
Thank you. Merci. Our next question. La prochaine question, Raymond Filion, TVA. Your line is open. À vous la parole.
Merci. Bonjour à tous. J'aimerais savoir combien de cas actifs du variant indien, le B1617, on dénombre actuellement au Québec et en Ontario, que ce soit des gens qui habitent dans ces provinces ou encore des gens qui y sont soignés actuellement.
Bon, merci pour la question. C'est Dr. Njoo et je suis reconnecté maintenant. Désolé pour les problèmes techniques avant. Mais on continue, je pense, avec toutes les provinces et territoires de faire la surveillance pour les variants préoccupants. Mais à date, moi personnellement, j'ai pas les chiffres exacts, le nombre de personnes atteintes avec les variants. Je pense que c'est quelque chose en évolution, mais je pense que pour moi, c'est pas vraiment une question combien de cas de variants. On sait que les variants peuvent être plus transmissibles, mais je pense que le taux en total qui est le plus important, c'est un indicateur qu'est-ce qui se passe à l'échelle locale avec la transmission communautaire. Donc, si c'est un variant ou si ce n'est pas un variant préoccupant, les mêmes principes pour la santé publique, les mesures de santé publique, les précautions individuelles que tout le monde doit continuer à respecter et suivre, ça reste la même chose, mais c'est sûr, peut-être après, vous donner les chiffres plus exacts selon les données probantes que nous recevons des provinces et territoires. Je ne sais pas si Dr. Tam peut-être quelque chose d'autre à ajouter. Merci.
Okay, Rick. Oh, sorry, go ahead.
Oui, concernant le variant B1617, je pense que c'est ça la question. Donc, on a quelques systèmes pour le séquentage de variants maintenant. On a discuté avec le laboratoire de provinciaux et territoriaux pour maintenant pour détecter cette variant. Je peux dire qu'on a déjà le détecté dans le échantillon de voyageurs qui est dans la frontière internationale. Donc, on va avoir des chiffres à bientôt concernant cette variant. But just to say that we have, now that this variant has been reclassified to a variant of concern, and we know that there have been some cases, because we're sequencing 100% of cases of the samples coming across for travelers. So we should have that data available but we'll have to get back to you on that one. And we know that there have been cases detected in provinces and territories, and there may be some early signs that we already have some community transmission. But as Dr. Njoo has said, this variant shows increased transmissibility, a bit like the B117. We have not seen any data pertaining to the other attributes. It doesn't seem to impact our PCR diagnostics. It remains to be seen in terms of any impacts on vaccines and treatments. Some early antibody data shows that it may be, again, like the B117, there may be some diminished antibody response, but covered by the vaccine, but the vaccines will provide protection. So, the similar measures will be taken to manage the transmission of this variant as we have for other variants.
Sweetie Ray?
So as a follow-up, So as a follow-up, Dr. Tam, and perhaps Minister Hajdu, if you have any information, feel free to jump in. Is there anyone with the B1617 variant from outside Ontario and Quebec who is currently getting medical care in those two provinces, to your knowledge?
I'm not aware. We don't have data as to the individuals, patients that are being treated, but I do know that B1617 has been detected in more than those two provinces.
Okay, next question.
Thank you. Merci. Our next question, Kevin Gallagher, CTV National News. Your line is open. À vous la parole.
Hello. Thank you for taking my question. I'm interested to know. So this summer, providing things go well with the 75-20% ratios, we could go camping, hiking, have picnics, patios, and outdoor gatherings. But I'm interested to know what's the difference between this one-dose summer and the no doses that we had last year, because it seems like all of those activities were things that people were being encouraged to do safely last summer. So I'd like to know sort of what's the benefit, what's the encouragement for people to go out and get vaccinated when it seems like the restrictions are pretty much the same as what we had when we had no vaccines last summer.
Can someone hear me?
Yes.
My video feed has just disappeared.
I can hear Theresa, you. We can see you, Theresa. Go ahead.
Okay. So I think individuals who got the vaccine should feel more confident, even with one dose, that they themselves have been better protected. That's the key about that one dose, but you've got to get that second dose to provide maximal protection. We do know that there's increasing data to show that these vaccines can reduce transmission, the mRNA vaccines, for example. So that is a good sign. But the majority of the population only have one dose of vaccine on board. And I think, so in general, you're essentially behaving like you haven't as yet got vaccinated. You're only halfway. So that's the general message is, to all intents and purposes, it may seem like last summer, you're going out on your patio, you're going outdoors, that's a really good thing. You should feel that you've got another extra layer of protection. What I would say is that it was very likely that throughout last summer, there were transmission and hidden chains of transmission that has occurred that would lead to a resurgence in the fall. In this summer, one would hope that with all on board, with the ongoing case detections, and we've got to keep doing surveillance and trying to detect cases all throughout the summer in order to avoid any resurgence in the fall. So what's the difference between this summer and the previous one is that we stand a much better chance to having an outdoor summer that doesn't lead to a resurgence in an indoors fall. So that's more of a population health way of looking at things. But as an individual, you should feel much more confident if you've got any doses of vaccines on board that you yourself are better protected.
Dr. Njoo, maybe I can just add a couple of points to what Dr. Tam said. I think maybe the two aspects which are maybe different this summer compared to last summer is that in many parts of the country, we're still battling the third wave, right? And so the case counts are high. The healthcare systems in certain parts of the country are still sort of close to the breaking point. So that's why we certainly have to be very careful. And of course, as just I think with the previous question, there's also the issue of circulating variants, right? Many of them have shown to be more transmissible. So in some ways, there's a less of a margin for error in terms of individual practices and how you may be able to protect yourself. So that's why I think even if we have optimism and hope that the vaccines are going to lead us out of this pandemic, we can't let up on the public health measures, and that's why we're optimistic, and we want people to get vaccinated as soon as possible, recognizing that these two other factors are in play as well compared to last summer. Thank you.
Kevin, go ahead with your follow-up.
Right. Yesterday we saw from the U.S., sorry, I'm just getting a little feedback there, that they released, mask guidelines that when Americans that are fully vaccinated don't have to wear masks, no social distancing. So when will that type of advice be issued to fully vaccinated Canadians?
So I think from a public health community perspective and in discussion with chief medical officers, I think masks might be the last layer of that multi-layer protection that would advise for people to remove. I think we have to slowly and surely ease the more restrictive measures, those shutdowns and stay-at-home orders. Those are the really key things that we need to really avoid as a community, as a population, and not have a resurgence as soon as you release that. That is the primary objective moving towards the fall. If we get into the we might get 2 doses into arms quicker than the fall, but it's moving into the fall is when you go indoors. And we have to be very careful when we're going indoors. Even with 75% coverage, 25% of people may not be covered. So you actually have to be really careful as you slowly ease those measures. I think the data will direct us as to what to do and when that key moment is. The other thing, and Mr. Hajdu would probably want to comment on this, is that as individuals, of course, we're all different in different circumstances, with different ages, with different underlying medical conditions, and the ability to control our environment. So I think another thing that we're hoping to do is given further guidance to people in terms of risk reduction for their individual assessments. And there is no doubt that even if you are immunocompromised or you're someone who may not be able to mount an immune response, for example, you're going to continue to take a number of measures, including wearing of masks might be, again, as your last layer of measure to be taken off. So we are taking a bit of a different approach to the United States and maybe a little bit more similar to that of the United Kingdom.
Est-ce qu'on peut répéter la réponse en français, s'il vous plaît?
Alors, je pense Oh, ben, allez-y, Howard. Go ahead.
Non. Si vous voulez, ministre LeBlanc, c'est...
Non, allez-y.
C'est Dr. Njoo. Peut-être pour résumer ce que Dr. Tam a déjà constaté. Moi aussi, j'ai répondu à cette question, je pense, avant que ici au Canada, c'était plus une approche, comme dit, collective, communautaire. C'est pas vraiment une question pour un individuel, mais qu'est-ce qui se passe actuellement dans la communauté? Parce que si on est vacciné, mais on a aussi des autres peut-être en condition peut-être un système immunitaire affaibli. C'est important de continuer de porter un masque, même si on a reçu même 1 dose ou 2 doses de vaccin. Donc, je pense que c'est plus une question ici au Canada et avec notre infographique, ça démontre très bien c'est quoi peut-être le chemin à faire. Parce que c'est pas seulement une question pour une personne, mais c'est quoi la couverture vaccinale dans une communauté, mais aussi c'est qu'est-ce qui se passe avec les conditions, les situations épidémiologiques. Donc, il faut regarder vraiment les indicateurs, qu'est-ce qui se passe dans la communauté, aussi dans les hôpitaux pour les systèmes de soins de santé, avec la couverture vaccinale. Donc, c'est pas si simple peut-être comparé aux États-Unis de se demander, OK, qu'est-ce qu'on peut faire? Est-ce qu'on peut enlever le masque avec 1 dose ou 2 doses de vaccin? Merci.
Okay, we'll take the next question, please.
Thank you. Merci. Our next question. La prochaine question. Laurence Martin, Radio-Canada. Votre ligne est ouverte. Your line is open.
Oui, bonjour. Je me demandais donc pour votre objectif premier, là, qui est de 75 des Canadiens qui ont reçu une première dose, 20 qui ont reçu une deuxième dose, quand est-ce que vous pensez que c'est réaliste de franchir cette étape-là avec la progression de la vaccination que vous voyez en ce moment, les livraisons qui arrivent? Fin juin, début juillet, fin juillet, est-ce que vous pouvez nous donner une date un peu plus concrète, là?
C'est Dr. Njoo. Juste pour Mr. LeBlanc, peut-être pour commencer, ben moi, je peux dire avec qu'est-ce qui se passe à l'heure actuelle aussi avec les livraisons des doses de vaccins aux provinces et territoires. Je pense qu'on est dans une bonne position pour offrir tous les Canadiens admissibles pour un vaccin. Je pense d'ici la fin de juin, c'est en effet le début d'été. Donc, je pense que ça, c'est pour la première étape pour offrir au moins une dose de vaccin à tous les Canadiens admissibles. Et pour la deuxième dose, je pense que c'est vraiment ça dépend dans chaque province et territoire. Le déploiement des vaccins dans leur propre programme de vaccination. Je pense que c'est toujours une priorité pour offrir la deuxième dose aux groupes prioritaires comme les aînés et aussi les personnes à risque des conséquences graves, aussi le décès avec la COVID-19. Et au fur et à mesure, je pense qu'on va aussi offrir aux autres groupes prioritaires. Donc, pour la deuxième dose, on espère que aussi on peut offrir la deuxième dose à tous les Canadiens, peut-être une couverture vaccinale de 75% aussi à la fin du mois de septembre. En effet, aussi le début d'automne.
Et si vous me permettez aussi, Laurence, nous sommes énormément confiants de la capacité des provinces de livrer les doses de vaccins. Nous avons vu depuis déjà plusieurs semaines les provinces augmenter une capacité efficace afin de livrer les vaccins vers les populations ciblées et de plus en plus vers leur population générale. Alors, comme le docteur Njoo, je pense, a bien indiqué, et comme le premier ministre et Mme Anand ont dit depuis déjà plusieurs semaines, nous sommes confiants qu'avant la fin juin, tous les Canadiens qui aimeront avoir une première dose de vaccin pourront être vaccinés. On espère que ce sera à 75%, sinon plus. Et on connaît déjà des groupes prioritaires, que ce soit des professionnels de santé, entre autres, qui ont eu des fois des deuxièmes doses. Et les provinces vont acheminer les deuxièmes doses vers, comme le Dr. Njoo a dit, ces groupes prioritaires. Mais au courant de l'été, avec l'augmentation impressionnante de vaccins qui vont arriver au Canada, comme Anita Anand a bien indiqué, nous sommes tout à fait confiants que les deuxièmes doses pourront être administrées au courant des mois de l'été et peut-être au mois de septembre, comme le Dr. Njoo a indiqué. Alors, nous sommes tout à fait confiants qu'on est sur l'échéancier qu'on a décrit déjà depuis plusieurs semaines.
Suivi, Laurence?
And I will...
Wait.
Sorry, I'll let Minister Anand come in.
Well, and perhaps Minister Anand can say, my question was about the 20, and that's not my second question, but my question was really about like that 20% of second dose, when it's realistic to get that, so that we can go through this really first step that you guys mentioned earlier today.
Well,
so
Theresa
from
Tam,
maybe I can be more precise. I know that provinces and territories are already going back to administer the second doses. So long-term care facility, for example, I've been told that the majority of them are already getting their second doses. And then, of course, the healthcare workers and indigenous communities that were the initial cohorts. And so that's already happening. And why 20%? Well, 20% is a calculation on some of those highest risk groups. And by having them already getting their 2 doses, then you stand to lift those measures without overwhelming your ICUs and some of your hospital systems. While we're talking about the second dose, it is very important to get the second dose. But I just want to reassure people, because we have had a lot of questions about that dose interval. And you may have seen one of the studies coming out of the United Kingdom, which shows that even for seniors, these are over 80-year-olds, who got the Pfizer vaccine mounted a much stronger antibody response, 3.5 times stronger, when the interval was stretched and the second dose was delayed to 12 weeks compared to the 3 weeks. So I think for the people who are anxiously waiting for their second dose, I think that Canada and in following, I think all the provinces following the advice of the National Advisory Committee on Immunization, I think did a very smart strategy.
Minister Anand?
I would like to just underscore that this discussion is possible because of the increasing supply that is continuing to come into this country. Next week alone, Pfizer will be advancing another 1.4 million from the week after to accommodate the long weekend, in addition to the originally scheduled 2 million doses. So combined with the 1.1 million doses of Moderna that we expect to receive next week, also, we are going to see 4.5 million doses coming into this country next week alone, which is unprecedented in terms of our vaccine deliveries. It's as a result of our diverse portfolio of vaccines and the increasing ramp up in the millions of doses coming into this country that we can have this conversation about the supply and what that means for all Canadians. And for the federal government's part, we will continue to bring in millions and millions of doses into this country to support the provinces and territories in their inoculation efforts. Thank you.
Doctor, you maybe I could just add.
Sorry to interrupt. I just wanted to re-emphasize what Dr. Tam said, because I think it's so important. You know, Canada pursued a 2-dose strategy that had a delay between the first and second dose. And we know that there's been a lot of commentary about that. And, you know, many Canadians wondering what that meant for their health outcomes. And I think it's really important to reiterate that the science is finding that that delay is actually helping people mount even stronger immune response. And so, you know, this is what was the underpinning of NACI's recommendation, both to save lives and based on, data and historical knowledge of how vaccination works, that in fact, by delaying that second dose, that it would not impair people's ability to mount an immune response. And in fact, what the research is showing that is that it creates even a stronger response because of that extended delay. I think that is good news for Canadians who have been very patient and who have contributed so much across the country to making sure that everyone can get that first dose in their community. And I think it's another opportunity to say thank you to the Canadians that have come along with us on this approach that, yes, does differ than our American cousins, but is much similar to the UK approach. And so perhaps, Dominic, you might want to repeat some of that in French.
Est-ce que je peux juste poser ma question de suivi, juste pour qu'on...
Allez-y, Laurence.
Oui, juste ma question de suivi. Oui, parfait. Ce serait pour vous, d'ailleurs, M. LeBlanc. Par rapport au plan de déconfinement, bon, je comprends que vous donnez des orientations aujourd'hui, mais que ce sont les provinces là, qui, ultimement, décident quand elles vont déconfiner et comment. On a vu après la deuxième vague, les provinces qui ont déconfiné assez vite. Ça nous a plongé dans une troisième vague au Québec, en Ontario. Est-ce que vous avez peur que cette fois-ci, encore une fois, les provinces déconfinent trop vite?
Merci, Laurence. Moi, je peux offrir quelques commentaires et ensuite, si le Dr. Njoo aimerait ajouter ou quelqu'un d'autre, évidemment. Pour reprendre juste ce que Patty Hajdu a dit aussi, je pense que c'est important de souligner en français aussi que la stratégie canadienne de donner une première dose au plus grand nombre de personnes possible, et c'est ça que les provinces ont décidé ultimement de faire, quitte à donner une deuxième dose de vaccin à l'intérieur des délais prescrits, pourra probablement donner une meilleure immunité à la longue aux personnes qui ont reçu ce genre d'immunisation et le délai du deuxième dose. Madame Hajdu a parlé de certaines études qui peuvent confirmer que c'était une stratégie qui risque de donner une bonne et sinon une meilleure immunisation. Alors, nous sommes confiants de ça. Quand ce qui a trait à la question des réouvertures, vous avez raison. Peut-être après la deuxième vague, il y a certaines mesures de santé publique qui ont été enlevées à une vitesse qui a permis, avec l'arrivée des variants, on s'entend, qui a permis peut-être une troisième vague de prendre la relève. Il n'y a pas de doute que le contexte actuel, à cause de l'augmentation du nombre de personnes vaccinées et le respect des mesures de santé publique, les mesures sanitaires telles qu'énumérées par les provinces et les autorités locales, vont faire en sorte, et c'est ça que nous espérons, qu'on peut éviter une autre vague aussi difficile que la troisième vague qu'on voit présentement. Mais le premier ministre a été très clair cette semaine, la Dr Tam, le Dr Njoo, tout le monde, que c'est important de garder les mesures sanitaires en place suffisamment longtemps pour vraiment permettre à la courbe de diminuer, permettre en même temps le nombre de vaccinations à augmenter. Et c'est ça le travail que nous faisons en partenariat avec les provinces. La discussion entre les ministres du gouvernement fédéral, nos homologues dans les provinces et les territoires et au niveau des dirigeants de la santé publique comme la Dr Tam et le Dr Njoo font en sorte qu'on essaie de trouver une façon nationale de donner le même message aux Canadiens quant à qu'est-ce qu'on peut faire cet été, qu'est-ce qu'on pourra faire cet automne, et surtout à indiquer aux gens les possibilités de voir une réouverture économique sécuritaire, mesurée, mais fiable. Et c'est le travail qu'on est en train de faire avec les provinces et les territoires, et nous allons continuer de travailler d'une façon assez étroite pour s'assurer qu'on fasse ça dans une mesure coordonnée et cohérente.
Merci, c'est Dr. Njoo. Peut-être, je peux seulement souligner un autre point que le ministre Hajdu a fait, et c'est vraiment de reconnaître, d'après moi, le bon travail de notre comité consultatif national de l'immunisation. Ils ont vraiment analysé les données probantes. Ils ont aussi reconnu les principes d'immunologie et vaccination. Et c'est quoi ils ont fait leurs recommandations pour peut-être allonger l'intervalle entre les deux doses des vaccins. Donc, maintenant, on voit avec qu'est-ce qui se passait avec les essais cliniques, les résultats, qu'est-ce qui se passe au Royaume-Uni. Et on voit que Dr. Tam aussi a constaté qu'on a comparé c'est quoi la réponse peut-être immunitaire, peut-être niveau des anticorps pour les personnes qui ont reçu la deuxième dose après 3 semaines et après 12 semaines. Et on voit que même le niveau des anticorps, le système immunitaire, c'est 3 fois plus fort peut-être pour les personnes qui ont reçu la deuxième dose après 12 semaines comparé à les autres qui ont reçu après 3 semaines. Donc, et c'était très important de continuer de respecter l'évolution de la science, c'est toujours d'analyser et suivre aussi qu'est-ce qui se passe avec les données probantes. Merci.
Okay, we'll take one last question on the phone. Nous allons prendre la dernière question. Merci.
Thank you. Merci. Our last question, la dernière question. Stephanie Levitz, Toronto Star. Your line is open. À vous la parole.
Hi, thank you. I'm going to go back to a question that my colleague Kevin asked about what isn't and isn't on these guidelines released today. I mean, is this the best we could do? Is this the best we can give people hope and encouragement about why they should get just even a single dose of a vaccine, never mind 2?
Maybe I can start and then turn to the doctors. Well, first of all, thank you for the question. And I think the short answer is the best reason that someone should get vaccinated is to save their own life, to protect themselves from COVID-19, and to stop the spread to their family and their community. That is the best reason to get vaccinated. It will save your life. It will stop the spread in your community. It will protect your family. It will protect your colleagues. But, of course, we wanted to also give people an indication of what increasing vaccination in the the country and in communities would look like, and what kind of activities we could anticipate would be returning to our everyday lives as a result of increasing vaccination. And of course, we are a federation, which means that provinces and territories have dramatically different healthcare systems. They have different epidemiology. COVID is, in some cases, even right now, significantly surging in some regions. In other regions, there is very little COVID. So it is hard to have a national guidance that gets at the specific nature of COVID-19 in particular regions. But this is a roadmap for Canadians. This gives Canadians a vision of what it looks like as we proceed down this vaccination path together, what kinds of activities we can anticipate we can enjoy without worrying about either catching COVID or transmitting COVID. And certainly, I think it helps provide that guideline for Canadians as they undergo their own community's journey with vaccination. So I think for me, this is an important step forward. It does provide a unified vision for the country, but allows for that local public epidemiology, how much COVID is in a community, how much vaccination has occurred within a community, and those variables are important. And that's why the companion piece online really gives Canadians an indication of those kinds of metrics that they can follow along for a more specific understanding of their own region's risk factors. Dr. Tam?
Yes, so these are obviously very broad targets and guidance, and we would look towards providing more specific guidance for individual settings or situations like we have all along, but now with the vaccine on board. So I think that's a different kind of communication. But I think for the general public, I think the key is that vaccines play a really important part. When you only have mostly one dose on board, keep going with all these protective measures, but the outside is great. You can get outside and do lots of things safely. With a view, in the not too distant future, by the way, especially if we can get the second dose covered fast, is that we can then get safely back indoors and do some of the really key things that we've missed doing without a rebound. So I hope, of course, that's only one way of encouraging the public to get vaccinated and still hang on for those public health measures, given that we're not yet down the curve. We've got lots of other ways of communications, as well as, I think, different innovations in providing fundings to local jurisdictions or organizations to get people vaccinated, incentivizing people to get vaccinated in different ways. I think lots more carrots will be good. And just so that I can end by giving a shout out to Peel, Peel region is doing an all night long vaccination clinic, and they're going to have fun things that will keep people be drawn there. But if you got shift work, for example, an all night clinic sounds just the thing that would be quite attractive. So lots and lots of different activities will have to take place to get Canadians to that kind of target. But these general overarching targets, I think, are helpful.
Stephanie, follow-up?
Yeah, just as a follow-up, just because lots of folks are also pointing to this idea of a one-dose summer, two-dose fall, and saying, well, if vaccines are coming online at the rate they're supposed to, ought it not be a one-dose spring and a two-dose summer, and then we're actually back to normal by fall? And I wonder what your assessment is of that. Is that fair for people to think, or are we still too far off from moving up that timeline in a meaningful way?
It's Patty again. I would say that if that is possible, of course, that's the ideal state. And we are working, and I know my colleague, Minister Anand, is working day and night to get vaccines into the country earlier and faster. So this is a target based on our current projections. Of course, it could shift to be an earlier target where we see more people more rapidly vaccinated with a second dose. And if that's a possibility, of course, provinces and territories are eager to pursue that approach as well. But I will say that we remain focused on this as a realistic target, and we will adjust our projections if the situation changes. Anita, would you like to add a few words?
Sure, Patty. I will just mention that that work of procurement that Patty just described to accelerate doses to earlier and earlier time periods in this year is exactly what we do at PSPC every day. And as a result of our negotiations that are ongoing with suppliers, we've already accelerated 28 million doses from later quarters to earlier quarters this year. So we will continue to pull in unprecedented numbers of vaccines into this country. As I mentioned, 4.5 million doses alone next week. And we will have, by the end of May, in total, 25 million doses of vaccines brought into this country alone. And so, yes, the vaccine procurements and deliveries are continuing to accelerate. But as my colleague, Minister Hajdu, mentioned, we want to be realistic. And if it turns out that we can adjust, we certainly will do so, but it's important to be realistic in terms of what we are bringing in and what Canadians can expect as a result. Thank you.
Est-ce qu'on peut répéter les réponses en français, s'il vous plaît?
Oui, bien sûr.
Allez-y, Anita.
Non, vas-y, Dominic.
Allez-y, Anita.
D'accord. Comme j'ai déjà dit en anglais, chaque jour, chaque semaine, mon département et moi travaillent pour accélérer des doses plus tôt dans l'année. Déjà, nous avons déjà accéléré plus de 28 millions de doses pour avoir des doses dans les mois ici maintenant et plutôt de maintenant. Donc, pour la prochaine semaine, nous aurons, je pense, 4,5 millions de doses pour la semaine prochaine. Et pour le mois de mai, plus de 25 millions de doses auront ici au Canada. Donc, ça, c'est un projet, une approche qui est réalistique et nous devons penser de nos approvisionnements chaque jour, mais c'est important d'être réalistique aussi. Merci.
Ça a mis la fin à la conférence de presse. That's the end of the press conference. Have a great weekend, everyone.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.